obviously, COVID-19 has had a huge impact on all of us in some way, shape, or form. I can only imagine how it impacted you guys on probably a couple of different fronts. Let's start with internal. What's different pre, during, and I guess we're kind of edging on post a little bit here, but
Yeah.
how were things like, how did it go here?
I think we're drastically different than pre-COVID. We had to think on our feet. We had to shift. Everyone down from front desk all the way up to the admin building here had to readjust what they did. We wanted to stay open. The individuals that we serve were the most vulnerable during this pandemic, and so we knew we couldn't close our doors. And so we had to think outside the box to make that happen. A lot of our programs went virtual. We were able to determine and figure out how to do applications over the phone and online and any other means that enabled people to apply for our services without having to physically be here. Internally, we had to 6 feet, put up barriers and allow people the safety of still being able to work and help our community while at the same time remaining safe and for themselves and for their family. We didn't want to put our employees in jeopardy. We didn't want to put them in a place where they had to choose the safety of their family versus their job. And so we made a lot of changes here for that. We instituted a lot of work from home procedures, telework procedures, which we've never had in the past. Flex schedules, anything that we could to enable our employees to continue to work and help. On the health side, obviously everything turned upside down. We became COVID. COVID appointments, COVID vaccines when they finally came out, COVID testing. I wish I had the latest numbers for you, but I know, when we turned into the new year, we were probably over 12,000 to 20,000 COVID tests that we had performed in 2020 and edging on 10,000 vaccines once those became out. So we got really, really good at organization and getting those out fast and to the public is safely and as fast as possible.
A couple of questions for you. You mentioned that a lot of things did become virtually, forms and things to that effect. Knowing that social interaction is actually a component to having a good mental health, are you worried about that long term? How things being more virtual could possibly have a negative effect, or are you not concerned about that?
I think that those that truly need that are coming in. We offer telemedicine. It's not huge anymore. A lot of individuals are choosing to come back. They feel safe here. We're still doing a lot of the safety protocols that we did at the very beginning, even though hopefully the pandemic is dying down a little bit. We still mask up in our agency and we still use all of those safety protocols. So I feel like our patients feel comfortable coming back into the office when they need be, but they also have that option of telemedicine that they didn't have before.
You mentioned that you were a distributor of vaccines.
Mm-hmm.
We live in an area that's kind of distrustful towards government, anything government related. We're Appalachians, I guess by definition, that's who we are. Did you guys witness any brushback regarding that sort of program? And if you did, how did you guys address that sort of thing?
Not as much as we've heard in other areas. We were prepared for it just in case, but we really didn't receive a lot of negativity for those that came. The majority of people that came to our testing sites or our vaccine sites were very appreciative of the work that we were doing, of giving them that option. We tried to not push, anyone's agenda. This was just, this is what we're offering and we're here if you need us. And that seemed to work very well. And we did not get a lot of the negativity that a lot of the other areas had claimed.
So lessons. COVID-19, lots of new challenges.
Mm-hmm.
Is there anything that you found out due to this blessing or curse of a pandemic that maybe you guys weren't doing right before, or you guys were doing, or you can go the opposite and actually say things that you just were doing really, really well before. Is it going to change anything for you long term?
Well, I think anytime you go through something like this, you make changes. If you don't, then you're not going to succeed. We learned to look at employees differently. A lot of burnout happened during this time, and so we learned what we needed to do to make sure that our employees were taken care of. We learned that our staff, our managers, everyone truly do work here at Change Incorporated for the good of the community. We had a lot of difficult times, the last couple years through this pandemic, trying to figure out how to make things work. But they always succeeded. We always found a way to make sure that we were getting our services out there. And I think that speaks to the versatility and the commitment of our employees here and how dedicated they are to this community and to making sure everything is getting to those that are most vulnerable in our community. So we learned from those. We learned how versatile we are. We learned that we can pick up and move and try new ways to provide our services. We learned that we can embrace technology to help us. And so I think those lessons will take us a lot farther in the future.
Well, thank you so much. I appreciate your time.
You're welcome. Thank you so much.